If you're beyond 60, there's one thing you do every single night that could quietly elevate your stroke risk, without any pain, without any warning, while you sleep. No cardiac discomfort, no garbled speech, no dizziness to alert you. You retire to bed feeling perfectly fine. By morning, something has shifted. You awaken confused, unable to articulate clearly, or you can't raise your arm. A stroke. Silent, sudden, and life-altering. All because of something as simple as how you sleep. As a neurologist, I've witnessed this excessively often. Not because of smoking or poor nutrition or insufficient exercise, but because of common sleeping habits that most seniors believe are safe. They're not. Today, I'm going to guide you through 9 dangerous sleeping positions and nighttime routines that may be increasing your stroke risk, brain bleeds, or blood pressure surges, particularly in the quiet hours when your brain is most vulnerable. If you or someone you love is beyond 60, this video could preserve a life, maybe even yours. So don't look away. Let's commence. Before we continue, if you're not already subscribed, I suggest clicking that button and activating notifications so you won't miss future health guidance designed specifically for you. Should this video provide value, enter 1 in the comments section. If it doesn't, enter 0 so I understand how to create superior content for you. 1. Sleeping flat on your back with no pillow, supine head level. It seems harmless, even comforting. Lying flat on your back at night, arms at your sides, no pillow under your head. For many seniors, it's a habit that started decades ago. Some say it helps with back pain, others feel it opens up the chest. However, here's what almost no one communicates. Sleeping flat on your back without elevating your head can silently increase your stroke risk overnight, and you might never feel it approaching. When you sleep completely flat, your head is on the same level as your heart. That might sound natural, but physiologically it's not, especially not in seniors. You understand, as we age, the vessels in our neck and brain lose their flexibility. Blood doesn't flow as efficiently. The veins meant to drain blood from your brain must now fight against gravity. That means instead of draining smoothly, blood can pool, slow down, and even clot, particularly in the early morning hours when blood pressure naturally rises. When blood clots form during sleep, they don't stay quiet for long. One small clot in a narrowed vessel and the consequences can be devastating. Slurred speech, facial drooping, permanent disability, even death. I want to share about Mr. Leonard Whitaker, a 77-year-old retired mechanic from Michigan. Strong, independent, still fixed lawnmowers in his garage. Every night he laid down flat in bed, no pillow, just the mattress and his hands folded on his chest, a habit he picked up from his Navy days. He said it helped him sleep deeply. One morning, his wife Mary discovered him half awake but unable to speak. His eyes were open, yet one side of his face had fallen. He couldn't lift his right arm. In the ER, a scan revealed a clot in his left middle cerebral artery, a type of ischemic stroke that happens when blood thickens and clots inside narrowed vessels, frequently during sleep. His carotid arteries were stiff, blood had pooled too long, and it was all linked to his sleeping position. Doctors worked quickly to dissolve the clot, yet Leonard was never quite the same. His speech is slower now, he uses a walker, and every night Mary carefully props him up on a wedge pillow, something they both wish they'd known about years earlier. What most individuals don't understand is that when you lie flat, particularly with age-related vascular changes, venous drainage from the brain becomes compromised. That's medical language for this. Your brain's plumbing system slows down, and stagnant blood can become a breeding ground for clots. Add in natural overnight dehydration and low oxygen saturation, and you've created a perfect storm. This position proves especially dangerous for seniors with hypertension, atrial fibrillation, sleep apnea, a history of carotid artery disease, or those on blood pressure medications that drop pressure too low at night. The safest adjustment? Slight head elevation, about 30 degrees. It helps gravity assist blood flow, reduces intracranial pressure, and allows the brain to oxygenate more evenly. Even 1 or 2 supportive pillows can make a profound difference. Always choose a pillow that supports the natural curve of the neck, not one that tilts the chin forward. Some individuals think this is just about comfort. It's not. It's about blood flow to the most delicate organ in your body. It's about protecting your independence, your memory, your ability to speak, to walk, to be you. Leonard told me once with tears in his eyes, "Doc, if someone had just informed me that sleeping flat could accomplish this, I would have changed it years ago." Let me be that someone for you today. However, if you think that's concerning, wait until you learn what happens when you sleep face down, where your neck bends in just the wrong way, cutting off the very arteries that feed your brain. If you're continuing to watch and discovering these insights beneficial, please type number 1 in the comments indicating your engagement. Now, let's advance to point number 2. 2. Sleeping face down, prone position. There's a quiet mistake many seniors make every night, one that feels comforting, familiar, and even harmless: sleeping on your stomach. Perhaps you started doing it to ease back pain. Perhaps you like the pressure on your chest, or the way it makes you feel cocooned and safe. However, I'm here to inform you something you may have never heard from your primary physician. Sleeping face down can be one of the most dangerous positions for your brain. In medical terms, it's called the prone position. In younger bodies, it might not cause much harm. However, as we age, our circulation slows, our arteries harden, and our oxygen levels dip more easily, particularly during the deep sleep stages. When you sleep face down, several dangerous things begin happening. Your neck turns sharply to one side to allow you to breathe. This position compresses the vertebral arteries, which are responsible for carrying oxygen-rich blood from your spine to the back of your brain, a region controlling balance, coordination, and even your ability to stay conscious. However, that's not all. This posture also places pressure on the carotid arteries, particularly when your head sinks into a soft pillow or mattress. Blood flow is slowed. Veins that are supposed to carry blood away from the brain become kinked. Stagnant blood collects, thickens, and in vulnerable individuals, it forms blood clots. These clots may sit quietly for hours, waiting until the early morning surge in blood pressure hits, dislodging them and sending them directly into the brain. The result? A stroke, often massive, sometimes fatal. I'll never forget Mrs. Ethel Lawson, an 82-year-old retired schoolteacher from Ohio. She came to me after a terrifying experience. Her daughter had discovered her one morning lying awkwardly on her stomach, her speech garbled, and her left side unresponsive. Ethel was rushed to the hospital, where imaging revealed a large ischemic stroke affecting her cerebellum, the part of the brain responsible for coordination and balance. However, the cause wasn't high cholesterol or atrial fibrillation. Ethel's carotid arteries were narrowed with age, and the hours she spent sleeping face down with her neck twisted had reduced blood flow just enough to allow a clot to form. By morning, the damage had been done. Ethel survived, yet she no longer drives. She struggles to walk without a walker, and she tells me every time we meet, "I had no idea something as simple as how I slept could nearly claim my life." Here's the science behind it. In the prone position, neck rotation can impinge vertebral artery flow by more than 40%, particularly if the pillow or mattress forces your head backward. Chest compression can reduce lung expansion, producing low oxygen saturation, which places additional stress on your heart and brain. Obstructed airflow can increase carbon dioxide retention, which further alters brain blood flow, frequently leading to vascular instability. As we age, we don't tolerate oxygen drops the way we used to. Our body's natural response time is slower. A 30-year-old might wake up gasping and readjust, yet at 70 or 80, the same drop in oxygen might pass unnoticed, silently setting the stage for nighttime stroke. If you're someone who snores, has sleep apnea, or takes sedatives or sleep medications, sleeping face down is even more dangerous. Your body is less responsive, your airway is more likely to collapse, and the chance of a silent, oxygen-starved stroke increases. If you or someone you love is in the habit of sleeping on the stomach, I urge you, try switching to your side with a firm pillow that keeps your head aligned. Or better yet, sleep slightly elevated on your left side to help protect both brain and heart circulation. These small changes are not about comfort, they are about survival. Because what feels cozy might be putting deadly pressure on the very arteries that keep your brain alive. Remember, it's not just about how you sleep, it's also where pressure builds while you sleep. Because next, we're going to discuss a sleeping habit millions of seniors fall into, particularly those with hip or shoulder pain, that quietly cuts off blood flow and leads to sudden strokes in the night. And it happens on your favorite side. 3. Sleeping with a heavy blanket over the head. There's a small, deeply personal habit that many seniors carry with them into old age. Something comforting, almost childlike, that we do without thinking. We pull the blanket up over our heads at night. Perhaps it's to block out noise from a snoring partner or a humming fan. Perhaps the room feels drafty or too bright. Or perhaps, like many who grew up in colder homes, we find a kind of peace under that cocoon of warmth and silence. However, for seniors, this small nighttime habit can quietly turn deadly. When you sleep with a heavy blanket over your head, you're not just blocking light or sound, you're limiting airflow. Over the course of the night, oxygen levels drop inside that tiny space. Carbon dioxide, the waste gas we exhale, builds up around your nose and mouth. While your younger body may have tolerated it decades ago, at 60, 70, or 80, your brain doesn't recover the same way. Low oxygen and high carbon dioxide during sleep increase your risk of blood thickening. In vulnerable brains, it forms blood clots. Let me share about Mr. Richard Hale, an 81-year-old retired postmaster from Iowa, a quiet, thoughtful man. Richard always liked the feeling of sleeping in the dark. He told me he'd been pulling the covers over his head since childhood. Especially in winter, his wife had gently teased him for it, saying he looked like a bundled-up caterpillar every night. However, it made him feel safe, relaxed, and so every evening he tucked in tightly, pulling a thick quilt over his head and curling into sleep. Then one morning, Richard didn't get out of bed. His wife, alarmed, discovered him groggy and unresponsive. He could barely open his eyes. When the ambulance arrived, his blood oxygen levels were dangerously low. A scan at the hospital revealed he had suffered a silent stroke in the early morning hours. A clot had formed and lodged in a small vessel deep in his brain, not from atherosclerosis or atrial fibrillation, but from oxygen deprivation during sleep, paired with age-related blood thickening. And yes, one of the risk factors? Sleeping with restricted airflow under a heavy blanket. You understand, during deep sleep, particularly REM cycles, your brain needs consistent oxygen flow. When you're under the covers, rebreathing stale air, your oxygen drops. Your heart compensates by beating faster, and your blood pressure begins to fluctuate. These spikes and valleys put stress on already fragile vessels. Add in mild dehydration, slow circulation, and age-hardened arteries, and you've created a perfect setup for a clot to form. Here's the terrifying part. You might never know it's happening. You go to sleep feeling warm and safe, yet your brain is suffocating slowly, and by the time the damage is done, you may wake up a different person, if you wake up at all. Medical studies have demonstrated that even mild hypoxia, reduced oxygen levels during sleep, is linked to a significantly increased risk of stroke and cognitive decline in seniors. This isn't only a risk for those with diagnosed sleep apnea, it can affect anyone whose breathing is disrupted by environment or posture. If you're someone who sleeps with a blanket over your head, even just during the winter months, it's time to rethink the routine. Instead of pulling the covers up, try wearing a sleep mask to block out light, or use earplugs for sound. Keep your room at a comfortable, warm temperature and invest in breathable, lightweight bedding. This isn't about discomfort, it's about protection, about giving your brain the oxygen it needs to restore, repair, and survive the night. Because strokes don't just happen to other people, they happen to good people, thoughtful people, people like Richard who had no idea that a lifelong habit could nearly steal his ability to walk, talk, and remember. He now sleeps with a wedge pillow, soft lighting, and his blanket folded below his shoulders. He told me quietly, "I never knew something that felt so safe could be so dangerous." He's not alone, because what we don't know can hurt us, particularly while we sleep. However, as dangerous as a heavy blanket over the head may be, it's nothing compared to the next habit, one that millions of older Americans rely on for comfort, yet it might be cutting off blood flow to the brain, starting with the way you rest your arm under your pillow. Let me show you how it happens. If you're continuing to watch and discovering these insights worthwhile, please type number 1 in the comments indicating your presence. Now, let's proceed forward with point number 4. 4. Sleeping upright in a recliner, frequent in seniors with back pain. For many seniors, sleep becomes more difficult with age. Not just falling asleep, but staying asleep without pain or discomfort. Achy joints, stiff spines, acid reflux, and shortness of breath all lead to one common solution: the recliner chair. You may know someone who's abandoned their bed altogether, or perhaps that someone is you. Night after night, recliner sleeping becomes routine. A soft blanket, the television humming faintly in the background, the chair angled just right. It feels secure. However, what feels safe can sometimes be quietly dangerous. As a neurologist, I've witnessed how this position, sleeping upright in a reclined chair, can slowly, silently increase the stroke risk overnight. You understand, the human body was designed to rest flat, with blood and oxygen flowing evenly. However, when you sleep in a semi-upright position, say 45 to 60 degrees, you're putting your circulatory system at a disadvantage, particularly if you're older. In this position, gravity accomplishes two things. It pulls blood downward away from your brain, and it compresses the major veins in your legs and hips. The result? Sluggish blood flow pooling in the lower limbs and a much higher risk of clot formation. In younger bodies, this isn't as dangerous. However, after age 60, the situation changes. The blood becomes thicker due to age-related dehydration, the vessels grow narrower from decades of wear, the heart pumps less efficiently, and that slow-moving blood pooled in your lower body can form clots, small, sticky, silent threats that may travel upward during the night or early morning hours. All it takes is one of those clots lodging in a vessel in the brain. The damage is done before you even wake up. Let me share about Mrs. Barbara Keene, 79, a retired florist from Kentucky, a lovely woman with a sharp memory and the gentlest smile. She began sleeping in her recliner 5 years ago after hip surgery made lying flat too uncomfortable. Just until the pain goes away, she told herself. However, the pain lingered, and over time, the recliner became her bed. She'd wake up, stiff but managed, until one morning her daughter discovered her still in the chair, confused and barely able to move her left hand. She hadn't felt a thing, no warning. However, a scan revealed she'd had a lacunar stroke, a small, deep stroke caused by a clot that had lodged in one of the tiny vessels inside her brain. She had no major heart condition, no atrial fibrillation. What she did have was poor circulation from years of sleeping upright. Her legs would swell, her ankles often felt tight, and every morning she'd feel dizzy getting out of that chair. Looking back, the signs were there. However, she, like many, never imagined that a recliner could quietly become a stroke trap. Here's the medical truth. Sleeping upright reduces the effectiveness of the baroreceptor reflex, the body's natural system for regulating blood pressure. In flat sleep, your brain and heart communicate more easily to balance pressure. However, when upright, particularly if you're tilted forward or slightly twisted, that reflex weakens, producing blood pressure instability. In seniors, this becomes dangerous. Add in medications, dehydration, or compression from tight socks or swelling, and you're facing multiple risk factors at once, all while you think you're just catching a comfortable night's sleep. So, if you're someone who sleeps in a recliner or loves naps in that chair, consider this your wake-up call. Sleep is not just about rest, it's about positioning your body to protect your brain. If you must sleep elevated, use a hospital-style adjustable bed, or a firm wedge that elevates your torso without compressing your lower limbs. Be sure to stretch and move your legs regularly to support circulation. Barbara now sleeps in a bed again, with her head slightly raised and a body pillow supporting her hip. She tells me often, "I believed I was making things easier for myself. I never thought I was making them more dangerous." So many individuals assume the danger is in moving too much. However, for seniors, the danger is often in staying still, in the wrong position for too long. However, if you think a recliner might cut off blood flow, wait until you see what happens when you sleep on your favorite side with your arm pinned under your pillow. It feels natural, comforting, yet it may be the most damaging position of all. Let me explain why. 5. Sleeping on the right side with arm under pillow, most dangerous. There's a position that millions of individuals find comfort in, particularly seniors. It feels natural, it feels secure. You lie on your right side, tuck a soft pillow under your head, perhaps cradle another between your knees, and out of habit, slide your arm underneath. You drift off thinking it's the same way you've slept for decades. However, as a neurologist, I have to inform you, this is the most dangerous sleeping position I witness in older adults. Not because it causes pain, but because it quietly restricts blood flow to your brain night after night and may be increasing your stroke risk in the very hours when you believe you're resting safest. Let's break it down. When you lie on your right side, particularly with your arm wedged under your head or pillow, you're putting direct pressure on major arteries and veins in your neck and shoulder, including the carotid artery and the subclavian artery. These are critical vessels, highways for blood traveling to and from your brain. However, when they're compressed for hours, the flow slows, blood pools, veins get squeezed, arteries narrow, and in the quiet stillness of sleep, stagnant blood begins to thicken. It forms blood clots. That clot might stay in place for hours until you shift in the early morning. Your blood pressure rises with the sunrise. The clot dislodges, it travels upward, and in seconds, your brain is starved of oxygen. Let me share about Mr. Ellis Randall, a 75-year-old Vietnam veteran from North Carolina. Strong-willed, fiercely independent, he used to joke that he could still outrun his grandson. Every night, Ellis slept on his right side, just like he had since the military. He'd curl his arm under his pillow for neck support. He told me one morning his wife discovered him halfway out of bed, dazed and unable to move his left leg. He was rushed to the ER, where imaging revealed a right hemisphere stroke caused by a clot in his middle cerebral artery. However, Ellis didn't have high cholesterol. He wasn't diabetic. He didn't smoke. So where'd the clot originate? As we reviewed his habits, it became clear. Chronic pressure on the right side, combined with years of sleeping on that arm, had compromised his vascular flow. Ultrasound showed narrowing of the carotid artery. Because he'd been unknowingly reducing blood flow for hours every night, a clot formed silently in his sleep and struck just before dawn. Ellis survived, yet his mobility is reduced. He now walks with a brace and undergoes weekly therapy to rebuild his coordination. He once stated to me quietly, "I had no idea the way I slept could betray me." Here's the truth. This position doesn't just affect arteries, it also compresses the brachial plexus, a bundle of nerves that runs through your shoulder and down your arm. When that bundle is squeezed under your body weight, the nerves don't just go numb, they send distress signals to your brain and can interrupt your sleep cycle without you realizing it. Over time, this poor circulation and nerve stress may contribute to microvascular damage, the kind that builds quietly until it breaks. Seniors are especially vulnerable because with age, blood vessels stiffen and narrow, blood becomes more viscous, recovery from restricted flow takes longer, nerve resilience decreases. So if you've been sleeping on your right side, particularly with your arm underneath, it's time to make a change. Not because of comfort, but because of life-altering consequences. Try switching to your left side, with your head gently elevated and your arms resting forward or alongside the body, not underneath. Use a contoured pillow to keep your neck in alignment and reduce pressure on key vessels. One small change may protect your independence, your memory, your ability to embrace your family, walk your dog, or speak your grandchild's name. You might not feel the damage being done, yet your brain remembers. Your blood flow records it, and eventually the body reacts. Because what you don't know while you sleep can change everything when you wake up. However, if you think sleeping on your arm is risky, just wait until we discuss what happens when your body tosses and turns all night long, and how restlessness itself may be a red flag your brain is trying to warn you before disaster strikes.